So I don't know if you can tell, but I'm a bit sick, and it's perfect timing because I want to talk about Bernie's Medicare-For-All bill that I didn't get to discuss last week. So Bernie recently rolled out his plan for Medicare for All, and I'm going to really break down two main reasons why it's a brilliant plan. And first up, number one reason is its coverage. It would cover hospital visits, primary care, medical devices, lab services, maternity care, and prescription drugs, as well as vision and dental benefits. Now, as a Canadian, I'm kind of jealous because this plan is actually better than what we have in Canada. The Canadian healthcare system, for example, does not cover vision or dental care, prescription drugs, rehabilitative services, or home health services. Now, the other main reason why Bernie Sanders' Medicare for All plan is brilliant is because of its ability to survive negotiations. Now, what do I mean by that? Well, his plan is to roll this out in pieces. In the first year, benefits to older people would be expanded to include dental care, vision coverage, and hearing aids, and the eligibility age for Medicare would be lowered to 55. All children under the age of 18 would also be covered. In the second year, the eligibility age would be lowered to 45, and in the third year to 35. By the fourth year, every man, woman, and child in the country would be covered by Medicare for All. Now, if you remember when Obama was trying to get Obamacare pushed through, it was already sort of a compromise. So Obama came to the table with a private insurance-based healthcare system, an idea that was actually a Republican idea from the 90s. Now, even though Obama came to the table with the compromise, the Republicans still fought him on it. Now, with Bernie Sanders' plan, if they don't have the votes they need from the Democrats, there are negotiations that are able to be made. So right now, Bernie's idea is to have it for 55 and older and 18 and under within the first year. But if you want to whittle it down, you could maybe say, okay, we'll do 55 and older in the first year, and then in the second year, do 18 and under. This way to sort of shield the costs so that it's not all happening at once. Now, or you could do, you could just do hospital visits and primary care in the first couple of years, and then add on dental and vision benefits. So there are various ways that this bill could sort of be picked apart, but still survive the basic idea of a Medicare for All system that will eventually happen down the road. So even if it's not happening all at once, and even if it's not happening within the 4-year plan that Bernie has laid out, it can still be negotiated to a point where eventually all of these benefits can be added on. So that's why this is really a brilliant idea. And it's one that the Democrats, I think, can push through even the way as it is now. Now that you're seeing co-sponsors like Kamala Harris and Cory Booker coming on. But obviously, we're going to see if those sorts of corporate Democrat co-sponsors are going to push it through with the same vigor as a Bernie Sanders would. So that remains to be seen. But in the meantime, they are co-sponsors. So it's good to remain open-minded until we see any evidence otherwise. Now, of course, the question is how to pay for it. And I always find it funny that this question only comes up when it's about investing into the people of the country. So how to pay for it only comes up if it's healthcare, infrastructure investment, or college tuition. But when it's wars or when it's tax cuts for the rich or large multinational corporations, the question of how to pay for it rarely comes up, or at least rarely gets the type of response from articles like this Fox article that I'm quoting, where 1/3 of this article is focused on how will Bernie Sanders pay for this bill. That said, it is a question that should be asked, and it's important to note that with a Medicare for All system, you are already actually cutting down the costs than what you would expect with a private insurance-based system. In fact, a 2011 study in the Journal of Health Affairs estimates American doctors spend 4 times as much dealing with insurance companies compared to Canada, meaning the cost to an individual in a Medicare for All system is already less because you're not dealing with a private insurance-based system where there are all these different insurers. So Medicare for All is just one system, so there are less administrative costs up front. And on top of that, individuals no longer are having to pad the pockets of these private insurance companies who are making these large profits, or at least have a profit motive in the healthcare industry. So there is no longer, with a Medicare-For-All system, there is no longer a profit motive driving the healthcare industry. Now, how to pay for this Medicare-For-All system is actually going to be dealt with in a separate bill. And so far, there are a number of suggestions being made. Suggestions that include a 7.5 payroll tax on employers. But this does exempt a company's first $2 million in payroll from this tax, which would help to shield small businesses from the increased cost. And on top of that would be a 4% income tax surcharge on individuals, a tax that families making less than $29,000 a year would be exempt from. Now, people may think, oh no, new taxes, scary. But when you actually spend a brief time, just 1 or 2 sentences explaining that you no longer have to pay a private insurance company, and not only are you not paying private insurance, you're saving time not having to negotiate with these insurance companies. I think it would turn a lot of people onto this idea, because obviously a Medicare-For-All system is not going to be passed, or is not going to be able to be effective without some extra taxes. But if you're not paying a private insurance company, you no longer are paying a premium, then you understand that it's coming through your taxes, and you're actually saving money as everyone is on the same system and everyone is sharing the cost. So when you think of it that way, and you realize that there's money saved in having less administrative costs, and money no longer going into a profit motive for the healthcare industry, in the end, this is a brilliant plan. And I think it's one that will eventually happen. Now, is it going to happen under a Republican Congress? Obviously not. But, I mean, it's a matter of time. Trump, it doesn't seem like Trump is really going to be in office past 2020. And whether it's 2018 or 2020 or beyond, Congress is also likely going to flip. But we're going to find out. And right now, I'm optimistic that this will one day happen. And when that happens, I'll be a jealous Canadian, because your system will be way better than mine.